Every year, lakhs of students prepare for NEET. Most dream of becoming doctors. But what if your journey takes you into dentistry? Is BDS a second choice? Or is it a powerful career in itself? What is life really like inside a dental college? And how difficult is the journey? So, I'm trying to say is like, how many hours do students actually spend in clinics? Or what are the biggest struggles young dentists face today? And if you're planning to choose dentistry, what should you know before making one of the biggest decisions of your life? So today's episode answers all these questions. Stay with us because today's conversation could change the way you look at dentistry forever. So, namaste everyone. Welcome. I'm Kapeel Gupta, career consultant, study abroad expert, life mentor, and the host of Kapeel Gupta Career PodShow. Our mission is simple: to help students make better career decisions, not based on assumptions, but based on real conversations with people who have actually walked the path. Because every profession looks glamorous from the outside until you speak to someone who has lived it. And that's exactly what we do here. So today, we are entering the fascinating world of dentistry, and joining us is someone who represents the new generation of dental professionals, who has balanced academics, clinical practice, research, national conferences, and continuous learning with remarkable dedication. She completed her BDS and is currently pursuing her Master of Dental Surgery in Periodontology. Has presented research at national conferences, received prestigious awards, participated in advanced workshops, and continues to build herself as a clinician and researcher. But beyond all these achievements, today we want to understand the human side of the journey. What really happens inside a dental college, and what makes students quit sometimes, and what helps others succeed. And how do young dentists handle pressure, patience, long study hours, and of course, career uncertainty? And if you're a student preparing for NEET, thinking about BDS, or simply curious about life as a dentist, this episode is for you. And it gives me immense pleasure to welcome Dr. Aakansha Mishra. Dr. Aakansha,
Hello,
welcome to
sir.
the Kapeel Gupta Career PodShow.
Hello, sir. Very grateful for you to have me here.
It's an absolute pleasure to have you with us today, and really grateful that you agreed to be part of the show.
Thank you.
And I know you are very much busy in your college life, of course, with the exams and all. So, without further ado, let's begin from the beginning. And I want to begin this, I would say, from your childhood days, right? You know, every career starts with a dream. And of course, as a student, there's a different life altogether. So, how were you in your school days? I want to understand that.
Looking back my school life, I think the person I'm today, right now, it's like played a very vital role in my current life because I was very much like a curious student who enjoyed learning and actively participated in both academics and extracurricular activities. So for me, school wasn't just a place where I studied, but it was where I learned the importance of discipline, teamwork, and how to actually build communication with people. So I was someone like every student, I experienced my fair share of challenges. There were moments where I was balancing both like activities, Like I was participating in school sports days and everything. But those experiences taught me valuable lessons, like in the management also. So if I say I was someone who was very much like, okay, teacher ne bola hai, I have to do it. Like someone who is
Yeah.
like can't think of any other thing else. So I think that made me a person a bit serious about my what things I do and how should I take those things seriously. And of course, I had my parents with me, so they let me do my sports also. I was into sports. So, all of that, my friends and everything. So it was much more like a student who was very much involved into different things at the same time.
Awesome. Awesome. So I would say you were managing your academics and your extracurriculars side by side. But if I may ask you, were your parents very much pushy? पढ़ लो, पढ़ाई कर लो, वरना भविष्य कैसे बनेगा? क्या वो भी फ्यूचर से डराते थे आपको?
Yes, they would do that because I feel वो उनका एक self, I think that was a something they as a parent they wanted to make sure that whatever I do it. मतलब ये नहीं होना चाहिए कि कि करना है अच्छे से करना है कोई भी चीज मजे में करो बट जब पढ़ना है पढ़ो जब खेलना है खेलो वो चीज बहुत मेरे अंदर लाइक बहुत ही पहले से रखी गई थी दैट पढ़ने के टाइम पढ़ाई करो यू कैन डू योर थिंग व्हेन यू डू दिस यू कैन डू दिस तो इट वाज मच लाइक कि अगर मैंने 2 घंटे पढ़ लिए आई कैन गो 1 hour एंड प्ले 3 घंटे पढ़ लिए
Okay.
आई कैन गो 1 hour एंड प्ले समथिंग लाइक दैट सॉर्ट ऑफ सिचुएशन.
So can I say that you were a very disciplined person in your school life? Or no?
I was because disciplined as in कि just that कि अगर ये चीज बोली गई है आज देना है तो आज ही देना है like that.
Okay.
And बचपन से घर से भी वो एक माहौल था कि कर लो होमवर्क कर लो ये कर लो. I used to be more like करना है ये सब करना है काम. So I used to come from school थोड़ा सा रेस्ट कर लिया अपना काम कर लिया. So it was like because I was the elder sister so I had my younger brother. तो उसे भी थोड़ा सा वो रखना माहौल में कि you have to be a bit disciplined and everything. That's why my nourishment was such that I was taking things a bit seriously in the school life also.
And what about your friends? आप बड़ी इजी गोइंग थी विद फ्रेंड्स, पार्टी करनी है फ्रेंड्स के साथ या नहीं ठीक है स्कूल में हो गया बस जो हो गया?
I was very introvert, very, very introvert.
Okay.
Because of that, I had very less friends in school. But जितने भी थे, at least I used to talk to people, like जितने भी students in and around with me. And ऐसा भी रहता था कि because school life में ऐसा होता था कि you don't think much from your mind. You just do your heart. So ऐसा रहता था school life है and that time there was not much of social media also. तो हम जाते थे अपना खेलते थे और उतना माइंड में नहीं रखते थे चीजें बिकॉज उस टाइम पे वैसा नहीं रहता था. तो
Hmm.
फ्रेंड्स तो थे आई वुड से एंड जो स्कूल लाइफ में होते हैं एंड सब कुछ ही बहुत ही अच्छे लोग मिले स्कूल लाइफ में भी जो अभी तक है मेरे साथ. So very
Awesome.
grateful
Awesome.
for that.
That's good. But see, when we think about our future, that's when career begins to take shape, and especially in a dream first. So, if I may ask you, what inspired to choose dentistry? And was this always the first choice, or did life take you in this direction?
Uh, if I have to begin with, firstly, I was just like any other kid. Like I was just मैंने 12th pass out किया. So उसके बाद I was much more like I have to go into biology, something in biology. And that time, मेरे time पे it used to be either engineering or medical. यही दो चीजें चलती थी that time. So I was like, I was not that much keen on doing engineering. I was like, I want to go into biology, something in biology and something in medical. ही था मेरा first choice. But then eventually, just like any other kid, I was just like, you need देना है, and then I'll get into some medical. और वही एक ऑप्शन है. उस टाइम पे आई हैड नो आइडिया कि डेंटिस्ट्री या बीडीएस करके डिग्री पता थी कि एमबीबीएस बीडीएस होम्योपैथी आयुर्वेदिक ऑल ऑफ दीज थिंग्स आर देयर बट आई वाज जस्ट लाइक डॉक्टर मतलब एमबीबीएस दैट्स इट. that's what it is. And so yeah, I was more like that. But then eventually, जब मैंने counseling attend की, so I got into uh, with different people, जो मेरे friends थे. Among them were some people who were actually applying for BDS. So
Okay.
उनमें से कुछ लोग ऐसे थे, and they told me that it is not just this. There is something other part of the story also. There's something the different path also here. So MBBS भी है, BDS भी है. So I was like, okay, so this is something interesting and I should know this. So मैंने बात की कुछ लोगों से that what actually this course offers me. So I got to know about it and I was more like, okay, this is something I can go for and this is what actually I can be at. So that's what I choose. Dentist.
Okay. Interesting. And see, I would agree that almost everyone knows about MBBS. Even if you are not studying biology in 11th and 12th, still you're aware of MBBS. But what I get it is that they don't really understand what dentistry actually involves, right?
Yeah.
And as you talked about counseling, were they your school counselor or your parents made you connect with some professional counselors? One thing. And secondly, if a class 11th or class 12th student came to you today and asked, should I choose BDS? What are the things you would want them to know before making that decision?
Okay. So firstly, I was not with the contact with the counselor. It was just that the students who were around me, they were having their people and like the parents who were actually dentists. So they already had an idea, very much idea about what actually dentistry involves. So I had a conversation with them and they told me about the course and what actually things you do in that. And that really made me very much keen and very much interested into the course. So just counseling actually is like after you fill up the papers, forms in the NEET, you go in different counseling rounds by the NEET itself. So the
Okay.
first counseling round, second counseling round. So in that also I got to know about what all actually, and I got to talk to people like there. So that's how I come to know and came to know about it. And if I say like if a 12 student comes to me right now and asks me about this, so firstly I would say that this is like one of the most important questions because many students choose a medical degree more. They are like I just want to have a medical degree and that's what they know. So now I think now people are more aware, what I'm also seeing into my clinic also, that people are asking that, okay, अगर नीट देना है तो ये भी एक अच्छा ऑप्शन है तो इसमें कैसे हमें जाना होता है क्या इसके लिए भी नीट देना होता है क्या इसके लिए भी कैसा प्रोसेस होता है तो अभी जो लाइक स्टूडेंट्स भी आते हैं तो वो भी यही पूछते हैं कि हाउ टू एक्चुअली गो थ्रू दिस So if I have to say, then I have to say that firstly that you have to know about the course because now you have a lot of resources. So you can actually go through those courses and actually study what actually this course offers. So I don't want the students to just jump in with a medical degree in their mind. I want them to understand that dentistry is not an alternative, but it's an independent degree. It requires your hand skills, communication skills, and continuous learning. It's essential. So, like before even thinking about just being blind about it, I think students must just talk to or just go through the resources on the internet and they can actually work on it and they can know much more about it.
So, can I say if students have exposure to professional counseling at an early age, that would be a great benefit to them,
Yes,
right?
it would be really great. Yeah.
Yeah. And see, many times what happens is, for example, students live in dreams, right? When they people in uniform, then they are crazy about it. And similarly, when they see doctors, so their white coat, yes. So it is like, okay, it's their uniform. It's something very, you can say, bring about a lot of responsibility when you wear that coat.
Sure.
But as people, we don't see the journey behind that. There's a person behind that quote, and that person has a journey. So what I want to ask you today is that please take us inside your dental college. Okay. That is, what is a normal day like for a BDS student? How demanding is the academic workload, or is it easy? Or what kind of practical training you undergo, or the clinics you have? And of course, the stressful examinations. What's all about? Love to know that. I'm sure my students also, the listeners, would love to know your life in a dental college.
Okay, so to begin with, firstly, if I have to describe my journey in BDS, so I was just like any other kid. I was just like, okay, now I have got into BDS. Now let's see how it is and everything. And so, if I have to describe in one sentence, firstly, it was challenging, it was transforming, and incredibly rewarding. Like, but if I have to start with the first year BDS, so in the first year, you actually are more into adjusting zone because you have just come and cleared your 12, and most of them I feel don't have an idea about what actually the BDS offers. So in the first year, it's much more of adjustment. You adjust with the environment, you adjust with a lot of people around you also, and a lot of questions in your mind which are there in your mind, like how. So first year is more like you study the medical subject just like the MBBS people do. So that is the common thing in us, that we also study the same anatomy, physiology, biochemistry, pathology, everything. And first year is common for BDS and MDS, where we do all the anatomic work. And coming to the uh, second year, you do more of the preclinical work, like you go into preclinic and you have to work with the dental, more of the dental. So first year is all about medical, third year is dental, and third year you actually do the patient. The second year is all about transforming yourself into preclinical work, and third year is all about your clinics. You enter the clinic, you do the patient first time, and then obviously it's your final year, which is more of theoretical knowledge and exams and all the submissions, all of these things. Like there's a lot of things. So I think you have to be very much curious about your course. You have to be passionate about your course. Initially, you might have many questions, but eventually, when I also started, I had many questions in my mind. And second year made me more comfortable with the environment, and because it's new, it's interesting. So you become inclined towards it, I feel, because there were many people like me only in my batch. We had 100 people, 100 students in one batch.
Okay.
So most of them were not someone who were coming from a dental family. They were not having dentists. So all of them mostly we all were in the same boat, you can say. So you have to make friends, you have to communicate with people around you. And I feel it was more of emotional growth as well. So
Okay.
every challenge taught me something valuable that shaped me into more confident person what I'm today.
Okay. But see, this is what academics is, right? You're
Yeah.
spending most. But as when we talk about college, especially when we were kids, we were in school. So we dream of the college life, right? And many people feel the college life is very much about like the Karan Johar movies, right? All dance and all. But apart from your studies, was there some fun element to the life in college also, or all studies?
No. It's all everything has to be done, I feel. You should try into extracurricular, you should try into something public speaking. So I in the BDS, like I did my BDS in Ratnagiri College. So I was at the Ratnagiri College. So it was more of the rural, in the rural Maharashtra side. So I would say that I come from Mumbai. So for me, shifting to that particular area, particular environment was a bit like adjustment. but I was grateful for the people I met during BDS. So that is very important, that you have to communicate with people, you have to make friends. So I think the teachers also were really nice, and they knew that things are changing, so the students have to be more made comfortable. So in my BDS, I was we used to have freshers. Firstly, when you come, you enter the college, you have your freshers party. You have you network with your seniors also. You have your seniors with you. The seniors play a very vital role, I would say, in your whole journey of medical degree, be it
Okay.
MBBS, be it BDS, anything. And I was also very introvert, as I told you that I was very introvert. I used to not talk to much people. Uh, those 4 years, I was very introvert. 4 years of my BDS. So I would say I was involved into more studies that time, and I was doing my clinics also. I used to because different patients used to come into our clinics. So I think academics was very similar what you actually do in your colleges. You do your lectures, morning lectures we used to have. Afternoon we used to go to our clinics and do our preclinical work. Then, apart from academics, if I have to say, I there were many functions and many much public gathering functions used to be there. Like there used to be a fest. Like there was a proper month given yearly. Like in the year end, there used to be a fest in which we had to celebrate different days. Uh, like you celebrate your days, like you have your red day, you used to celebrate Bollywood day, you celebrate some
Okay.
costume day. You used to like you can like you can do whatever you can do into that, and you should I feel that you should enjoy to the best you can.
Okay.
And because that is a college time that you actually can enjoy to the best, and it is very important to make memories, because now also I remember those small things, and that's very cherishing. So
Right.
there were a lot of sports also. Like we used to go to different inter colleges sports days used to be there. There used to be conferences in our colleges. Different colleges people used to come out to our colleges, and it was a lot of fun, I can say.
Okay. Awesome. So I think now that this is where expectations often meet reality. But looking back now, if I ask you, what was the most difficult phase during your BDS journey? It might be academically or emotionally or personally. And how did you overcome it?
Okay. So the most challenging was because I was staying away from my home. It was the first time me staying away from home, different uh, locality. So that was initial. I took time to make myself comfortable with that. Different people, so and staying in a hostel environment, which I've never did before 12, before this period. So for me, that was challenging because I was
Okay.
very much like, uh, I can't stay. Maybe I had, should I opt for something different, BDS college, but into Mumbai side? Should I opt for that? Because when I got this college, I was more like, okay, this was just, I think, 6 hours away from Mumbai. So it was much more like, okay, I can go to my home whenever I want to. But then I got, I had to prepare myself more like, okay, now I have come to BDS. Now I have to give my input. I have to make my parents proud about it. Like I am doing this. Now I have to be more professional. So obviously, I think any student goes through all this emotionally. It was challenging for me. And then after that, uh, because it's a new course, so you have to adjust to those courses as well, what that course wants you to do, what expects from you. You have to do those things. And eventually, I think it was much more emotional challenges in the start. But eventually, as I reached my third year, I was very much comfortable with the environment and very much enjoying the whole journey. And I was like, I used to call, then there was a time also where I used to call my parents uh, that I will stay here only. I won't be able to come because I'm not getting, because you don't get leaves. That is the fact
Okay.
that you don't get leaves in medical colleges and dental colleges. You don't get it because you are expected to be there for your patients. So I think that shaped me really well, and I understood what this course expects from me, and I enjoyed it as well. Like I really enjoyed
Okay.
it. Yeah.
Okay, but I do understand. See, the first 6 months, I believe, are the toughest, right? When you are the first time in a hostel or first time away from home, right? And you know you'll not get to meet your parents very soon, right? So now, and many things come to our mind, right? So if I may ask you, were your classmates were there for your support, or were seniors were helping you more, or your teachers? Whom would you say helped you the most during that first 6 months of your time there?
I feel when I came, there were many students from Mumbai itself.
Okay.
So, and because it was a hostel, so you connect very easily with people. There are people around you. So I think everyone was in the same boat. They understood
Yeah.
each other. So we all used to give like, it's okay, you will go home, don't worry, just few more months, you will get holiday. But then eventually it was much more, I would say, my friends which were there in the first 6 months. And because we understood each other's difficult times, so it bonded us really well. So I think they were the like stepping stones into my emotional journey. So that's what I feel that friends were like firstly, because
Okay.
when you're away from your parents, you are more close to your friends, who people around you
Right.
when you're away from it. So I think those were the most person, like people who actually made me understand. And then of course the teachers really helpful and seniors as well. So everyone was really helpful.
मतलब सबका गम साझा था, सब सेम दुख से दुखी थे, तो एक दूसरे को समझ पा रहे थे, या एग्री. Okay, but then see, one thing I have always believed in is that every profession has a moment, right, when actually theory suddenly becomes real. Okay, so for you, when did you first feel that I am no longer just a student? Now I am becoming a doctor, Dr. Aakansha Mishra. So, can you tell us about that experience when you first realized, yes, doctor ab aa gaya as a prefix to your name?
I think that was the graduation ceremony
Okay.
when we were taking the oath. I think seeing my parents in front of me, seeing my friends around me, and we have to take an oath wherein it's for the patients that we take the oath that no discriminating any patient with everything. Like we have oath to take. And I think even before that, when I entered the clinics in my third year, where I was given the freedom to do the patient, and you can enter your clinic, you enter your clinics into third year. Before that,
Okay.
it's all about your theoretical knowledge, building blocks for your theoretical knowledge, and then you do the preclinical work. Preclinical work is basically you do the before clinical, you have to do preclinical work, which you have to do on the models which are there. So on the models you work, you make teeth, you know, and then you do it on the patient. So we have quota also for that. So you do your preclinical work for 1 year. You have to do quotas. You have different quotas for different things. So I think when I entered my third year, when I was given the freedom to do the patient, to actually make a diagnosis for the patient according to my those 2 years of knowledge, that time I felt, yeah, that actually now I'm able to diagnose it. I'm able to use my knowledge for the patient treatment planning. And then, of course, under the supervision of the teachers. And after that, what hit me really that, okay, now I am a doctor. Now I have made it. That was the graduation ceremony, seeing my parents happily smiling and my degree in my hands, the oath I was taking in my mind and in my heart. So I think that changed and that made me feel now I am a doctor.
Awesome. Awesome. Okay. See, eventually, every student reaches a crossroads. And of course, choosing a specialization, right? And you chose periodontology for your MDS. Now, for me, I would say BDS, okay, it's dentistry, Bachelor of Dentistry. I have known specializations in MBBS, multiple specializations. But even for me, dentistry was only dentistry, right? But you are doing periodontology. Now, that means there is a branch of dentistry. So, first of all, I would want you to tell us what are these specializations? And of course, why you got attracted to this specialty?
Hmm. Okay. So I think people often ask me like why I chose periodontology. But before that, coming to periodontology, I will like to mention that BDS and MDS are two different paths.
Okay.
Firstly, BDS you do, there's a 4 years of your academic, 1 year of your internship. So total 5 years of your BDS accounts for it. So after doing your 5 years, you are a doctor, you are a dental surgeon, you can perform all the surgeries, but limited to BDS.
Okay.
What you can do the surgeries, but you can do the root canals, you can do the very much common things what all dentistry can do. But I think for me, uh, I wanted to go into academic. I love teaching. I love explaining what I have the knowledge and also love gaining knowledge from all around people around me. I'm very curious. I've always been curious about it and I love learning and teaching. So for me, it was very much clear that I want to go into academic. So for academic, when you are planning, you are ought to have a MDS degree. So for me, it was very simple that I want to do MDS. So because I think even before that, people don't know about the 9 branches of the dentistry. So
9. Okay.
yeah,
That is news to me.
yeah. So if I start with something like, oh, there is first branch is oral medicine and radiology. So basically, OMDR we say. So it's much more of diagnosis of the oral disease using your clinical examination and your radiographic technique. Okay, this is OMDR. So it deals with all your diagnosis, but then it is your oral and maxillofacial surgery. It is much more of surgical, where it's involved with your head and neck. So you perform the surgeries of your head and as well as of neck with just jaw-related surgeries as well, trauma, cyst, cancer patients, oral cancer patients, and everything. Then you have orthodontics, that is your correction of malaligned tooth, like all of your alignment adjustments. If your teeth is forward, it has to be done by the orthodontic department, and the jaws with the jaws, the braces, aligners, and all the other appliances. Then you have something called as endodontics. It is much more of your root canal specialist, you can say, which performs your all the root canal specialist procedures. And then you have your prosthodontics, that is your restoration and replacing the missing teeth, you can say, with the dentures, bridges, which we see in the patient. Then you have your periodontology, which I am doing. It is much more of a branch which deals with the surgery with the your foundation of your teeth, basically your gums and the bone of your jaws. So it is much more surgical. So it deals with surgical again. And then you have pediatric. It is a comprehensive like dental care for the patients of under the age of 15. So children and adolescent patients. And then you have public health dentistry. It is much more like community level dentistry, education, prevention, and public health initiatives, which we do. And then we have the oral pathology and the microbiology because it studies the diagnosis of the diseases of your oral mouth. So I think each branch has its own lot of things involved, and
Right.
people don't know about it. And I feel
Exactly.
still people don't know about it. They just know it's BDS and MDS, but MDS
Yeah.
में भी क्या कर रहे हैं?
Yes.
तो वो important है.
Thank you for answering this because this is real good knowledge for us. But see, out of these 9 branches, why did you choose this one? What attracted you? Why especially this?
Okay. Firstly, I would say that I was very much clear in my mind that I want to go into surgery.
Okay.
I want to perform surgeries, and I'm much more. वो एक होता है जब तक आपके ग्लव्स में वो ब्लड नहीं लगता तब तक आप को सर्जन नहीं समझते हो. हमारे में ये एक है.
Okay.
जब
Okay.
तक वो एक आप परफॉर्म करो एक प्रॉपर सर्जरी, तो थोड़ा सा मेरे माइंड में हमेशा से था कि मुझे सर्जिकल में ही जाना है, बट कौन सा ब्रांच लेना आई वाज नॉट क्लियर आफ्टर माय बीडीएस. आई वाज मोर इनटू की ओरल सर्जरी है, oral and maxillofacial surgery. That is into surgery. You have your periodontology in the surgery. So these two branches is much more surgical. But in oral and maxillofacial surgery, you perform your head and your so from head and neck you do the surgery. You can do the surgery related to your dental oral cavity only. So oral surgery demands a lot of duty work. Like there is much more. You have to work with a hospital. You have to give your hours of duties. You perform very much long surgeries, and you have to be working with a hospital every time. So
Okay.
even in the long run, you have to be with the hospital, and you have to get it touch with the hospital, or you have to have your own hospital. So it will demand you for that. Like in a setup, you have to uh, bit more connected with a good hospital. So I was that I want a very much flexible uh, my timings. Like I was like I want something where I can do surgeries also, and I can also have my own research and academic part also. I can balance those.
Hmm.
So oral surgery demands a lot of hectic schedules, like just like MD, MDS. So even they have their long duty, night duty hours. Same in oral surgery, you have your night duty hours. So I was clear now because I want to go into periodontology. I can do the aesthetic surgeries. I can do something which actually uplifts your smile and smile makeovers, your cosmetic dentistry, your implantology. Everything is dealing with periodontology. So it was much more like a flexible yet surgical branch.
Okay. Awesome. Awesome. And if any misconceptions students usually have about it, are there any?
In my branch, for my
Yeah.
branch, yeah,
Yeah.
I think there are certain, I think, things which are overlapping for periodontology is that firstly, people think that it's just your gums, right?
Okay.
It's just gums. And they are more like in my like the people who know about MDS, they know that periodontology deals with certain things. It is much we are called like soft tissue specialists because we are the only branch who deals with gums, the soft tissue of your oral cavity. Other branches are much more like your teeth and your jaw. So I think the misconception in my branch with what only one misconception what I have observed till now is that they are much more like it's just your gums part. Like we say
Okay.
gingiva. Gingiva is your gums, what we say in a dental language. So people have a bit of misconception that it's just your gums. But I
Okay.
feel for any building to be strong, your foundation has to be strong. So
Yes.
just
Very
like
true.
that, the oral cavity's foundation is your gums. Your teeth is into your gums. Your bone is covered by your gums. So everything happens to your gums that eventually leads to the disease into your bone, in your jawbone,
Okay.
right? So I think that is something. But now, of course, my branch people and other branch people also, they know that this particular thing has to be dealt by a periodontist only. They can handle it very well. So if there is a soft tissue surgery or any very precision involving surgery, then those surgeries come to us, and we work with interdepartment also. Like if we are performing a particular surgery and we want that tooth has to be get RCT treated, so we have to connect with a endodontist. First, they do the RCT, then they get us the patient for the treatment. So it's a very interdepartmental work in our field. So two, three departments work together for one patient. So everything is very much connected, and I feel the misconception still is not that much right now. Not there, I feel. But yeah, some misconception is there that it's just the gingiva, it's just your gums. But we make people aware that it's not just your gums, it's actually the foundation of your oral cavity.
Okay. Okay. So moving further, see, times are changing, right? Every profession is changing. And of course, the healthcare profession is, you know, changing rapidly too. And it's all happening because of technology. As a result, patient expectations are also changing. But of course, competition is increasing. इंडिया में कुछ और होना हो, कंपटीशन तो बहुत है, ठीक है ना? तो हम उसे बच नहीं सकते, भाग नहीं सकते. तो अकॉर्डिंग टू यू, what skills do you think every future dentist should start developing from day one? Of course, apart from academic knowledge.
Okay, a dental student has to firstly have the confidence, the self-confidence. They should be very much confident. And I think confidence comes from knowledge. If you have the right knowledge, you will be confident. And the real transformation, if I have to say, in my opinion, it will not just pass your exams. It happens when you actually trust yourself first, that whatever decision you're taking, you are taking from your thorough knowledge. And that's how I feel. Firstly, you have to be self-confident. And eventually, when you are a clinician, it happens when your patients trust you. You know, the trust is very important factor for a clinician. And that's where it transforms you into a confident clinician. Confidence like isn't something that you gain overnight. It develops one patient, one procedure, one experience at a time.
Okay. And see, when I was actually going through your profile that you shared with me, and I was just trying to understand your journey. So what I noticed that you've actively participated in conferences, poster presentations, research, workshops. So that actually made me curious, and I don't want to stop myself from asking that how important are these activities in shaping a successful dentist? And would you recommend every dental student step beyond the classroom?
Yeah, actually, initially also I was someone like it's just academics and I should focus on academics. These things are not important. This was in my mindset in my BBS then. And I feel your college plays a very important role. So your college, some colleges don't have that, they don't have that kind of exposure because of any reason. They do have, but not to extent that could change your mind and your point of view. So I strongly believe that learning shouldn't be confined to the classroom. It should much more of communicating. You should have your communication skills. You should be able to talk, public speaking, and your presentations, your networking, confidence, everything. So from the start, I was much more like I should just focus on academics, and that's what it is. But then when I did I went back. I actually applied for a transfer of my internship, and I applied through my MUHS, Maharashtra University of Health Sciences. So I applied for an internship transfer because I actually wanted to get more exposure and more curious, want to explore what actually dentistry is more up to a more better level. That was, I wanted to go back to my Mumbai city. So I applied there, and even that's a procedure. So you have to apply there, and according to your final year marks, you get your particular college. So I went there, and when I went to that particular college, engineering college, there I met people who were actually doing these researches, public speaking, all of these conferences from their BDS time. So I was very grateful that the people I met there, they actually helped me out and like transformed the introvertness in me to extrovert me. So I was much more into public speaking. I gained that confidence, and I went into research, and that actually gained a lot of confidence in me. And I was like, okay, this is also a side of dentistry, what I can actually do. I can also put in my things and my ideas into actually real time things. Like if I have an idea in my mind, like if I'm using an instrument, and because I'm using this conventional instrument, which has been in use since many years, 1990s, what invention has been done. So if I'm doing this particular surgery, now if I see that if this instrument could have this one feature in this, it could have been more better. It would be more convenient for me because I am, as a clinician, I am working, so I know that this particular instrument can be more better if I just put a ultrasonic a sensor into this, something sensor, biosensor, मैंने लगा दिया. So I was like, okay, even this thing I can do, even in these things I can work into. So I got to know this into my internship days, and it gained me interest into research and teachers there. And then I went and participated in many conferences, inter college conferences, state level conferences, national conferences. And also, when you go to the conferences, I would recommend people, students, to actually talk, network with the people in and around you because all are having different experiences, and you should learn things from everyone. And that's what shaped me and built the confidence in me.
So, can we say that your current college played an important role in shaping you who you are today? Am I right? Right?
Yes, yes.
So, can you just tell us something more about your college, what its name, where is it situated, and what exactly helped you there?
Okay. Right now, I'm pursuing my MBBS in Periodontology from Indira Dental College in Ghaziabad. So I think here the more exposure is here towards the research as well. We have like a different set of committee which actually deals with your research and innovation. You have your teachers with you. If you have any idea, you can pitch your ideas and you can actually work with them because they are the ones who are having a 20 plus years of experience with it. And they have many publications and innovative research under their name. So you actually work with them to gain the exact ground level experience with them from the scratch to the idea at a bigger level. So I think it's very much helped me to shape what I'm today also. And today also I'm working on different things. And if I have an idea, I can actually share it with my teachers and I can actually work with them on this. I think this helps really a lot because then you can actually things, conventional things everyone is doing right now, but the main competition is about what different skill you have, what difference you have in yourself, what actually you can offer to the patient differently from
Mm,
others.
right.
So right now it's much more of things because everything right now is going into AI and AI is everywhere. So even in dentistry, AI is there and AI is actually working really well. But I feel still you need a clinician, you need a dental
Mhm.
surgeon to perform, but AI softwares are there which can actually help in diagnosing more better precision and more faster diagnosing of your particular treatment plan. Um, so still it is in research, so you can actually work on that, and there are many opportunities that you can work on, which actually I'm helpful. I'm really grateful for my teachers also for building such like giving me ideas also, and you also work on your ideas also, so you can work on.
So can we say, because as you mentioned that your college gives importance to research a lot, so it upgrades its curriculum also as per the prevalent times, or it
Uh, I
lags behind there?
if like curriculum as in like
Because new techniques, new tools come in. So do they introduce students to them at an early stage?
yeah, what I have seen here, because now coming again from Maharashtra to Delhi, so it was something I experienced here that here also uh, there are different instruments. If a new instrument comes to into our department, if I talk about my department, we are introduced to that particular instrument, their working, and how it works, and what knowledge like we should have about that particular instrument, and then we are introduced to that instrument, we are made to work on that instrument, and then eventually I think you should be really updated with your new technologies as well. So there is CAD CAM right now, there is 3D printing, there is a lot of CBCTs, different AI softwares which we use. So I think yes, they do introduce to us, and they make sure that we are comfortable and we are actually, with the different technologies we're working on it, and we should be having the knowledge about that particular.
That's perfect. That means your college is actually doing wonderful work in this field, right? And now let's talk about something that students rarely hear honestly. That after completing BDS, what are the biggest realities young dentists face? Whether it's career opportunities, higher studies, private practice, financial expectations, or even building patient trust. So, what should students prepare themselves for? What do you have to say to that?
I feel you should be prepared that firstly, it can feel overwhelming because there are so many different experiences by different people. So you have to be first very much have the confidence in you that okay, things will be there, tough times will be there. There will be times that your teacher will out of nowhere will try to punish you with different things. They can say you things. So I think you should not be taking everything to your heart. You should be able to recognize what's useful for you, what is actually useful for you, and then accordingly you should be very much let go things which are not important to you. So I think you should build yourself such that you have self confidence in you, and just keep on learning, and I think learning should never stop, and it will make you a really good person and clinician. So I think that's important.
Okay. And finally, I would like you to speak directly to every NEET aspirant listening today, right? Just let's imagine a student sitting with their parents and trying to decide whether dentistry is the right career. So, what advice would you give them before they make that decision?
So firstly, I would like to say that there is a lot of myth about it right now also. Like, so I want that particular kid to have considering this degree not just like a second option, but a keen, interested kid who actually is passionate about this field. And eventually, I think they should know and understand this degree more and before entering into BDS. And because this will have expectations from you. This degree will have a lot of expectations from you. They will want this to be more of your communicative skills, your confidence. You should be passionate about it, because here you are using your hand skills. You are using your creativity. So that is why dentistry is also called as creative plus precision plus science plus artist. So there is a lot of this. What you think in your mind, you are actually doing it, and you are making that person feel confident. You are incorporating confidence into that person's life. So you play a very vital role for that person. So you have to build in that confident clinician first, or a confident person first. And that only comes from knowledge, from the right knowledge you gain. And that's what I want to tell a person, like a kid who has actually just passed out and applying for NEET.
Okay, perfect. No, that's very much true that it definitely the kind of opportunities this profession gives. So it should definitely be the first choice of people who are passionate about this career. No wonder, and I fully agree with you on this. So, Dr. Aakansha, thank you so much for sharing your journey so honestly. And today's conversation reminds us that behind every successful dentist, there are years of learning, practice, patience, self-doubt, discipline, and of course, an unwavering commitment to improving people's lives. So, dentistry is not simply about treating teeth. It's also about restoring confidence and restoring that smile, the beautiful smile, relieving pain, improving health, and sometimes bringing back a smile that changes someone's life forever. So, thank you, Dr. Aakansha, for joining
Very
us
great.
today. Thank you.
Thank you.
Thank you. Thank you. And to every student listening today, remember this: never choose a career because it looks prestigious. Choose it because you understand the journey, you respect the profession, and you can imagine yourself doing that work with passion for years to come. And that is what creates lasting success. So, if today's conversation helped you, share this episode with every NEET aspirant, every parent, and every student who is confused about MBBS and BDS, because one honest conversation can save years of confusion. And if you're looking for personalized career guidance to choose the right profession based on your aptitude, personality, interest, and long-term goals, my team and I would be delighted to help you. Until next time, this is Kapeel Gupta signing off from the Kapeel Gupta Career PodShow. Take care of your dreams, because your career is one of the biggest decisions of your life. See you in the next episode. Thank you.